Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, one-on-one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to talk about my disclaimer reminder before we get started, just that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. So, y'all know we have been going through our antibiotics. So, now let's apply it in a scenario and we'll continue to build. This is a more straightforward scenario basis, but I want you to kind of start beginning to look at these antibiotics in these formats, and we'll do a few from all of the systems so that you're able to get a good idea and learn how to apply it. So as you're studying, I want you to utilize this section to kind of help you tie these things together. So this is a real surface level on an application basis, and we'll build and get a little bit deeper as I do more questions each day, okay? So, all right, question number 1. The nurse practitioner has diagnosed the patient with acute otitis media. The patient denies any known allergies. What is the best first-line treatment? Is it A, ciprofloxacin, B, Bactrim, C, amoxicillin, or D, doxycycline? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, right? Reading the stem of the question first allows you to slow down to ensure you're answering what is even being asked of you. And I know y'all probably, and if you listen to my videos regularly, you hear me say this every single day. My review students who do my one-on-one sessions, y'all hear me say this, and this is the feedback I often get. Y'all know to do this. You hear me saying it, but you're not doing it because you get on the exam and you're just reading through the question, and you'll come back, or when I'm doing sessions and y'all do practice questions and we're reviewing it, it's like, oh, I missed that. Oh, I was going too fast, or oh, I didn't even pay attention to the word accept and things of that nature. Oh, I got tripped up because I was thinking they were going to ask this, and I keep saying, hey, when you read the stem of the question, I know it sounds crazy. I know it sounds like that's just an extra step, but I promise you, it allows you to stop before you start to formulate your own storyline, before you get all tied up in what the fluffy scenario is asking you. Go look and see what they're looking for in the question. So STEM here is, what is the best first line treatment? So we're looking for the best, not just any treatment, the best one out of all of the listed treatments and the first line treatment. So you already know this before you read the scenario, so you're already starting to process this, right? So now reading the scenario, the nurse practitioner has diagnosed the patient with acute otitis media. All right, so then you're thinking of treatments for acute otitis media, right? Then you're going through the process. All right, I typically would start with amoxicillin for acute otitis media if they don't have a penicillin allergy, right? It says here the patient denies any known allergies. So then that's how you know what to do, and it's straightforward. Now, this is, again, I did a real entry level question because I'm trying to help you easily apply it and know it. So as the stories and the scenarios build, it's easy for you to get these questions correct. It's a method to my madness, y'all. But here, if you pay attention to that, these little steps, I promise you, in the more detailed questions, this is what's going to help you to get it right every single time. I promise. Trust me. So again, so the answer here will be C, amoxicillin, because what? Acute otitis media, first line therapy is amoxicillin, right? And when we go through it, I'll tell you my Britney's brilliance on it. But think of the A's is what I say. So if you've done any of my reviews or have my review book, you know my Britney's brilliance mnemonic is, think of the A's. A for acute otitis media, A for amoxicillin. All right, question number 2. The patient diagnosed with acute otitis media was treated with amoxicillin 4 days ago. The patient continues to present with a fever and otalgia. How should the nurse practitioner treat? Is it A, amoxicillin, B, Bactrim, C, Augmentin, or D, doxycycline? Take a moment and tell me what you got, you guys. All right, so stem of the question. How should the nurse practitioner treat? Now, y'all know I always tell you, you read the stem, and if it's asking for a treatment, you want to first look and see if they have provided you with a diagnosis. If they have not provided you with a diagnosis, you know you got to run it back a step further and look at the assessment findings to determine the diagnosis so you can know what you're treating, right? But here they told us that this patient has acute otitis media. Now, and I'm going to give you a breakdown on all of this on a scenario to look at things too. So this is going to be multi-level educational purposes. So they already gave us a diagnosis of acute otitis media. The patient was treated with amoxicillin 4 days ago, but they're continuing to have a fever and otalgia, right? All right. So now we need to move to our second line therapy, right? Because amoxicillin is first line for acute otitis media. But you know the guidelines tell you if their symptoms persist greater than 48 to 72 hours after the initiation of that first line therapy, you go with the second line therapy now, okay? So you want to go with Augmentin, all right? Again, remember, Brittany's Brilliance says, think of the A's when we're treating acute otitis media. A's, the letter A. So A for acute otitis media, A for first line of amoxicillin, A for second line Augmentin. Now, a little sidebar note that I want to say, because when I was reading my question, it just made me think of something that I was discussing with one of my review students yesterday. Y'all know I always tell y'all to study in the fashion of assessment, diagnosis, evaluation, and treatment, right? And I tell you this because what? They test you in this fashion and we practice in this fashion. Think about how we document. Think about how you, when you're going into a room and you're seeing a patient, you're doing your assessment. Although we see all of this as our assessment, it's the full breakdown. So when somebody comes into your office and they're telling you about their symptoms, you're listening. So the symptoms are your assessment. You're assessing, you're looking at them, you're checking inside their ear, you're noting that the tympanic membrane is inflamed, all of these things are a part of your assessment. So when you're studying, you know that, right? Diagnosis. What steps are there? Any gold standard diagnostic exams? What steps are you utilizing to confirm these differential diagnoses, right? That's diagnosis. Evaluation. This scenario right here is a key point of evaluation. And a lot of people get hung up on, they don't realize that this is what you're considering as evaluation. And this is what we were discussing in our one-on-one session yesterday. So in a scenario like this, you knew that you treated acute otitis media with amoxicillin, right? But the evaluation is you also know to evaluate if they have been on any medications in the past, right? So have they been on anything for this acute otitis media in the last 48 to 72 hours? Because if so, then that warrants going ahead and bumping up to the second line therapy. This is an assessment of your evaluation skills. I know it's a treatment question, but when you get your scores back and you know how it's telling you if you have been unsuccessful on boards and it gives you the breakdown and it's talking about, hey, you were low in assessment, you were high in treatment, you were low in evaluation, all of these things, this is what it's referring to. So this is gauging your evaluation skills as well as treatment on this one question, okay? And this is why, because think about it. You had to evaluate the scenario to know how to treat. So the best answer here is C, Augmentin, again, because, hey, we have already utilized amoxicillin. Based off of their persistent symptoms in this, it tells you 4-day period. So you know that's greater than that 72 hours. So anything greater than 48 to 72 hours of persistent treatment after the initial therapy, we knew to go to second line therapy. Okay. I know that was a long spiel, but I'm trying to give you the full picture and studies tactic because I get so many questions on antibiotics. I just want you to see it from an application perspective. All right, and lastly, question number 3 for today. The patient returns to the office with acute otitis media. After reviewing the patient's chart, this is the 5th time in the last 3 months that she has been diagnosed with acute otitis media. Based on these findings, how should the nurse practitioner treat? Is it A, amoxicillin, B, doxycycline, C, azithromycin, or D, Bactrim? Take a moment and tell me what you got. All right, so here the stem of the question states, based on these findings, how should the nurse practitioner treat? So again, anytime they're asking for treatment, you need to, one, look and see if they provided you with a diagnosis, because if they have not, you got to go back a step further and you're looking for the assessment findings. So how did they present their signs and symptoms, etc., so that you can come up with a diagnosis, because we have to know what it is to be able to treat it, right? But here they have told you that the patient returned with acute otitis media. So we have a diagnosis, right? This is our starting point. And this is when you go down the whole pathway of acute otitis media. Now, the nurse practitioner is reviewing the patient's chart and notices that this is the fifth time in the last 3 months that this patient has been diagnosed with acute otitis media. Again, this is a part of that evaluation process and steps that I talk about. When a patient has persistent acute otitis media, right? Recurrent and persistent acute otitis media, there's different avenues of treatment, right? Because what happens is, and when they say recurrent and persistent, if they're having more than um three listed diagnoses of the, I should say, three listed different diagnoses of acute otitis media, different occasions where they have been diagnosed with this within a 6-month span, then you want to go with C, azithromycin. Now you can do, they have like a a combination, what am I trying to say? They have a combination of medication that you can do with multiple antibiotics. But I always tell everybody, for one, when you're testing on boards, and I'm saying this not to confuse you, but to tell you, because sometimes when y'all study and you go down this whole path, it's like, well, I saw this too. I want you to know, when you're getting prepared for boards, they're testing you on an entry level. So know your first, second line, and third. But when they start going into, hey, you need to combine this medicine and doing this many times a day, this is now the time that you are referring out, right? Because now this is getting out of your specialty that they're testing you on. This is out of your scope for your specialty level, okay? And that's also a key assessment that they're trying to identify on board. So this is why I tell you in this fashion. So in this scenario, because it is a persistent case, you will go with azithromycin. But anything after that, you are referring to ENT, right? For them to manage, to evaluate, manage, and treat, right? So make sure you know those steps and know that. But again, this was the final A of the A's that I talk about with Brittany's Brilliance. Acute otitis media. First line therapy, we treat with um, amoxicillin. Second line therapy, we treat with augmentin. And third line is azithromycin. You can use azithromycin if they are having these recurrent cases that I gave in this scenario. You can treat with azithromycin if they have a penicillin allergy. There are alternative options, but this is one of those key and best alternative that they like to go to based off of guidelines. So make sure you know those little steps, and when you're studying, take yourself through the full pathway. Write it down. It may seem tedious, but when you study in this fashion, and this is why I push this in my one-on-one sessions, when you study in this fashion, no matter how the question is presented to you, you can pivot, right? Because your foundation is strong. So again, amoxicillin, augmentin, azithromycin. All right, you guys. I know I talked a lot on this, but I just wanted to help you to kind of tie it together on multiple avenues and spectrums from the antibiotic and testing purposes. So I hope you find it helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. Share it out. To help other people as well, and it helps the channel to get out there to more, so that we can impact more of our nursing and NP community. I appreciate all of you who have been sharing and subscribing so far. And if you need any of the things that I offer, feel free to reach out to the nursing studio by giving us a call at 803 888-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. The things that I do offer are my review book. It's in an ebook and paperback option, both linked in the bio of this channel. If you prefer to review independently on your own, I do offer a self-paced review designed for family and adult Gerald. That's also linked in the bio of this channel. If you're looking to do any of the my QBank options, they're all linked in the bio of this channel as well. And then if you're looking to do one-on-one sessions, I always say reach out, as all one-on-one sessions are customized, gauged off of what you need. So I always say either give us a call, text us, or shoot us an email so that we can determine what's the best route and avenue for your study plan and your study needs. Okay, so make sure y'all meet me back here. Happy studying. Bye, y'all.